Did you know that there are actually three types of pain? These are nociceptive, neuropathic, and nociplastic pain. However, historically, we have been better at assessing and treating nociceptive and neuropathic pain. This has meant that common conventional pain treatments are focused on these two types of pain only. But this is a big problem because treatments for these two types of pain are often not helpful for nociplastic pain. Hey friends, welcome back to the channel. If you're new here, my name is Mahin and I'm an advanced practice physiotherapist specialising in pain management based in the UK. On this channel, we explore ways to improve our interactions with those living with pain to help them create healthier and happier lives. Today, I'll let you know about the three types of pain, how they are characterised, and what treatment approaches work best for each. To begin, let me quickly recap on the role of pain. So, pain is our protective system and is always influenced by biological, psychological, and social factors. Now, pain responds to anything that the brain determines as threatening or dangerous. This can be things like injury, so if we twist our ankle, pain is there to protect the ankle from further damage by stopping us from walking on it. But pain also responds to other things that's threatening, such as stress, poor sleep, lifestyle changes, and previous trauma that anyone may have experienced. The confusing thing is that pain doesn't tell us what it's showing up for, it just shows up as pain. Ultimately though, the brain will determine whether something needs to be protected against or not, and it will draw on lots of different information, such as nociceptive input, any senses that might be coming into the body, such as sight, smell, and hearing. And it will also draw on past experiences, memories, thoughts, beliefs, and expectations and predictions about the future. Taking all of this into account, if the brain determines that a situation is dangerous or there is potential threat, then it will send down a pain signal to an area of the body that it feels needs protecting. The brain is always weighing up then whether there is more evidence for danger or more evidence for safety. If there's more evidence for safety, then it won't produce pain. If there's more evidence for danger, then a pain response will be created. I've mentioned the brain here, but I want to be clear that pain is always real, whatever the type of pain. However, not all pain means that there is damage or there's a structural cause for it. But knowing the type of pain can be really important because it can help inform patient education and the treatments that we use. It may also prevent unnecessary treatments like injections or surgery taking place. So as I mentioned at the beginning of the video, there are three types of pain, and these are nociceptive pain, neuropathic pain, and nociplastic pain. So now I'm going to talk about each of these types of pain individually. First of all, nociceptive pain. So nociceptive pain is caused by stimuli, for example, injury, damage, inflammation, or any potentially harmful stimuli that activates nociceptors. For a better understanding of how nociception works, then you can watch this video here after this one. But examples of nociceptive pain would be osteoarthritis, rheumatoid arthritis, or rotator cuff related shoulder pain or subacromial impingement. For nociceptive pain, conventional treatments like medication, injections, surgeries, and tissue targeted exercises tend to work quite well. Nociceptive pain is the type of pain that we probably know the most about, and historically assessments and treatments have mainly been focused around looking out for nociceptive pain. When I have patients come in who've had scans or tests that haven't shown a clear explanation for pain because there is no structural cause to their pain, and because they don't have this nociceptive type of pain, then they don't fit into the right treatment categories. So, neuropathic pain. So this is caused by a lesion or damage or disease that affects the nerves. So examples of this would be sciatica, diabetic neuropathy, carpal tunnel syndrome, stroke, spinal cord injury, or MS. And in neuropathic pain, it's when the nerves themselves are affected. So for neuropathic pain, medication, injections, and surgeries like decompression surgeries can sometimes help. Medications don't work as well for neuropathic pain as they do for nociceptive pain. However, in the early stages, injections can work well for things like sciatica from a result of disc bulges or nerve root irritation. The longer that someone's had neuropathic pain for, though, injections, medications, and surgeries are less effective. The World Health Organization, in its 11th revision of the International Classification of Diseases, otherwise known as ICD-11, includes chronic pain in a diagnosis in its own right. This can be chronic primary or secondary pain. Chronic primary pain, which is pain that lasts despite complete tissue healing, or pain that has no identifiable cause, is nociplastic pain. And this is caused by a disturbance in peripheral or central nervous system pain process. And examples of this might be chronic widespread pain, fibromyalgia, chronic regional pain syndrome, or even non-specific lower back pain. And this is where actually there is no damage or structural cause for pain. So scans, tests often don't show the cause for pain, and that's quite normal and common. And that's because, as I mentioned before, not all pain is down to structural causes or damage alone. We know that pain does not mean damage. And a lot of what we've learned in the past 10 years supports that. And actually, that is why this third type of pain, nociplastic pain, we now know a lot more about than we did, let's say, perhaps 10 years ago. So in nociplastic pain, it's when the nervous system as a whole, the pain system as a whole, becomes overprotective and sensitized. And that's why pain can be felt in different areas of the body. It's not because there's specific issues in the specific joints where the pain is felt, but actually because the nervous system as a whole is on high alert, it sends pain to different areas of the body. And this is typical in fibromyalgia or chronic widespread pain, and why people report that their pain can change locations. It's also the case why 90% of lower back pain will not have an identifiable cause on an MRI scan. And that's because it's nociplastic pain, not nociceptive or neuropathic pain. Unfortunately though, conventional treatments like medications, injections and surgery do not help for nociplastic pain. Unfortunately, I see every day in clinic where treatments for nociceptive and neuropathic pain are tried in nociplastic pain, okay? So we try to almost pigeonhole nociplastic pain into the nociceptive and neuropathic pain categories and try to use treatments like medications and injections for nociplastic pain, and they just don't work. And that's because these treatments work better when there's a specific structural or nerve issue that's going on. And from a physiotherapy and exercise point of view, it's really, really important in nociplastic pain to move away from tissue-targeted exercise to values-based rehab, okay? And that's because we are looking now to treat the nervous system as a whole rather than specific tissues or joints or body parts. So talking about all of these different types of pain, it's actually not uncommon to have a mix of these different pain types all going on at once for someone. And I see this often with someone who, let's say, comes in with lower back pain, which has some spondylosis, okay, so there's some nociceptive pain going on there. But also there's a disc bulge that's contacting a nerve, causing nerve root irritation, and someone's presenting with radicular pain or sciatica, which is neuropathic pain. But then because they've had that pain that's been going on for a year or two, then actually they developed chronic widespread pain, okay, and that fits into the nociplastic pain category. So we can have a mixture of these three types of pain all going on at once. And when that's the case, again, tissue-targeted exercises might be important for, let's say, the sciatica type stuff, but more importantly, we want to treat the overall pain system, and that is through values-based rehab. To learn more about how you can move from tissue-targeted treatments to values-based rehabilitation, check out this next video here. This is an absolutely vital shift in treatment approach when helping anyone who's presenting with nociplastic pain, so make sure you watch that one next. Thanks for watching, take care, and I'll see you on this video.